What should we say about COVID-19 and the effects on health workers over 3 years? Because for the first time, I was in pandemic. It was first time in my life, but I'm not too young. I'm old, but it was first pandemic situation. And I think that I didn't read a single article about effects on mental health issues in health workers on the first, second, and the third year. So, few words about my place of work. I was not born there, but Kragujevac was the first capital of Serbia from 1990 to 1941. And we are very famous for this car made in collaboration with people from Italy. And also we made a first conference in applied artificial intelligence. I'm very proud of that. And this slide, this picture on the left is titled Kragujevac tree, which means connections between chemistry and mathematics, made by famous scientist Ivan Gutman, one of the world famous scientists, but the name of the picture is very important. But also I will remind of different images of my country. You may know Novak Djokovic, the first tennis player, and also Nikola Tesla, born in former Yugoslavia in Croatia, and he's still very famous, not only because of Tesla car. I like this slide, and I like to start to talk about COVID and implication of COVID of all of us with this picture. For sure, we know that nearly 1 of 5 person in the world will develop mental illness following COVID-19. When I say mental illness, it doesn't remain diagnosis or ICD-10-11 classification, but some kind of syndromes or more than one symptom. Also, when you search on PubMed and put only word COVID-19 in 2021, there is 142,000 articles. In 2020, 304,000 articles. And in 2030, it's 3,900,000 of articles. Then you put together COVID-19 and mental, there are less articles, but the number of articles is bigger and bigger from year to year, from 9,000 to 31,000 articles. The more specific topic of my presentation is our nurses, health workers, nurses, and resilience in nurses. You can see how many articles and how many journals are still interested in this topic, but I can say that it isn't easy to publish something about mental health issue like resilience, even in psychological journal or in psychiatry journal. When you send the article to psychological journal, they said, no, thank you. You are a medical doctor, you are a psychiatrist. This concept is psychological. Then you send article about resilience in a psychological journal, they said, no, you are a psychiatrist, you have to publish in psychiatric journal. So we are still waiting to publish the first article about resilience and the scale we used in our research, which is, you can see a little bit later, a brief resilience scale of 6 items. What I said last year and now is that working in the front line of pandemic, care and health workers especially face with a wide range of psychological stressors, which may cause acute, standing and long-lasting effects to the well-being and mental health. We are sure for now. In Serbia, for example, in my psychiatric hospital, which is an academic setting and university hospital, we have more cases of COVID than we would like to have. And also it is, off-on situation. We are relaxed, no COVID, and then there are some cases, and we are at the moment at the first line. So we still have COVID. World Health Organization recognize the importance of mental health issues, or all issues towards mental health workers, and pronounce 2021 year as a year of health and care workers, year of health and care workers, in order to help them to think about their mental issues and their well-being in general. We know that having been exposed to extreme working conditions for the past years, health and care workers are particularly vulnerable to the deterioration. On one hand, but on the other hand, we are prepared, choosing our professions, to be resistant and to be less vulnerable in extreme circumstances. I'm not sure that younger generations will agree with me, and I think that we have to think about them according to the results of our studies. There are a lot of articles in which this is one of to say, ordinary article, newspaper, talking about mental health, impact of COVID on health workers, especially nurses. More than 80% of them, registered nurses, said that the pandemic strained staffing in their unit to unsafe levels. It's a polite way to assign issues, and what does it mean? What does mean unsafe level? But 80% of interviewed people noticed that there are some big issues. First data from the 2020 explain how people react on COVID in healthcare settings, on COVID, with depression, anxiety, stress levels, in physicians. It's a Turkey study. Mexico also, and they included PTSD. They investigated problems with insomnia, depression, and post-traumatic stress disorder, and their results showed us that there are a lot of people suffering of at least one symptom at those time. It isn't. I just want to make a pause up here for the second. I started presentations a few weeks ago in Serbia, and they said, do you remember or that we spent 3 years in COVID pandemic? We almost lost 3 years. It was not 3 days, 3 weeks, 3 months. It was 3 years of our lives. In Serbia, my colleagues studied population of by survey, and they published results talking about medical health issues between medical personnel, but only on 2022. We published article about from academic settings, and I will explain the design of this study. But what we found out, that age, gender, economic status, family history of mental disorders, resilience, and for the first step, and for the step 2 in logistic regression, age, family history of mental disorders, and resilience were items or things that we should take in consideration for the future research. So we used this first step from 2020 to follow up, and we have results for the 3 years from the beginning of COVID until last year, on the beginning of last year. But we distributed a survey at January 23. The title of our research was Mental Health Between Healthcare Workers During COVID-19 Pandemics in Serbia in 3 consecutive years. We like to assess level of depression, anxiety, stress, and resilience, which means ability to cope with difficulties and recover from stress in healthcare workers in 3 consecutive years pandemic years, 2020, 2021, and 2022. And the second aim, and actually the main interest of my presentation, was to assess resilience in subgroup of medical nurses in 2022. We underwent anonymously, voluntarily, online research at the territory of Serbia during 3 consecutive years after we got decision of ethical committee. We invite and include all types of healthcare workers, all ages, all kind of work experience, governmental and private settings, but it was predominantly governmental settings because private setting is not so developed in Serbia. And we have 2 parts of the survey: socio-demographic data and clinical and self-reported scales. Thus, 21 impact of event scale and brief resilience scale. All 3 scales were with good data in Serbian population. This slide show us the total number of participants. You can see that from 1,123, we stay on 700 and 750. I have to say that we do not have the same participants, but we have the same study population, and we measured or chose between anonymity and data protection. So we decided to distribute the same survey in the same population, but not to same people, which is one of limitation of our study. In all 3 years, we had a lot of the same distribution between genders. Female responded more frequently than male participants in all 3 years. Also, orange pie represent physicians. They are majority of our population. On the second place were nurses. The same was for the 3rd year. Also, I didn't put data for the 2022. We predominantly, we have population with a lot of working experience. And there are several reasons. One is that young people didn't apply for job in the medical settings because they knew that they would be at the front line, and the older population were answered our question because they were active during COVID. We used I not exact with according to the salary, but a question about economical status. But we asked people how they are satisfied with their salary, and majority of them, or half of a sample, said I'm satisfied, or quite satisfied, or almost satisfied. No one, only 6%. Said that I can't afford everything for my family, which is surprising because we do not have good salaries, and we are not satisfied talking out of survey. When we are talking privately, we are not satisfied. This slide expresses interest in consuming cigarettes, alcohol, and other substances. It was descriptive questions. We didn't quantify and say how much cigarettes or how much drinks do you have. And we then realized that there are no, you will see next slide. Blue column, blue row means no signs of something. Dark yellow or dark brown means yes, they confirm that they use some of psychoactive substances, alcohol, cigarettes, of minority experience mental disorders in the family. One number of them had medicament therapy for something. Some of them complain about psychological disorders or symptoms, and some of them complain about pre-existing somatic disorders. It is slide from the last year. I will remind you only of that results from the pressure are a little bit disappointed because the scores of the pressure rise. Anxiety is going down. Stress is definitely going down. And resilience is going down, which is very interesting. And this is a slide about 2020 and 2021. Significant difference in expressing anxiety, less anxiety on the second year, less anxiety on impact of event scale, which means that COVID didn't touch us as much as in 2020, less resilience. We became less resilient from year to year, and slightly increase in the pressure. And it was a question for the 2020. And I didn't discuss, I would not discuss the pressure this time. But I can say that in 2020, we didn't show this increase that continue in 2022. Now, I'd like to share a few slides about the presence of somatic and psychological symptoms and resilience among medical nurses during the COVID pandemic, which means I'd like to title my presentation in the beginning, Did we forget COVID? And why? Why the answer is yes. So we decided to explore the impact of pre-existing somatic and psychological issues on resilience on medical nurses during COVID pandemic. Did we get answers? And why we didn't? 3 consecutive years, online survey, sociodemographic data, brief resilience scale, impact of event scale, and thus. Study included 302 health workers from Serbia. They were professional nurses with 12 years of education, high school nurses, which means 2 years more, dental nurses, pharmaceutical technicians, and laboratory technicians, all type professionals in the field of medical setting for nurses that we have in Serbia. They were at their workplaces during the COVID pandemic. Out of total sample, 214 health workers had no somatic disorders as a pre-existing conditions, while 44 reported the presence of various somatic conditions by their own perception. 292 nurses did not have a psychological disorder, while 10 health workers reported to present a certain psychological issues. Data were collected in 2022. Resilience was assessed by Serbian version of brief resilience scale, and somatic and psychological symptoms were identified to answer yes or no. Yes, I have those symptoms. I have, and no, I do not. The brief resilience scale contains 6 items. The first one, I easily bounce back from hard times. I have difficult coping with stressful events. It doesn't take me much time to recover from stressful event. I have a hard time quickly getting over some unpleasant events. I usually handle difficult situations with little difficulty. It takes me a long time to overcome life's obstacles. Scoring and scores of from 1 to 5 were assigned to response, from 1, which means strongly disagree, to 5, strongly agree. there are, according to the mean scores, we have 3 different categories. One to 2.99 indicate low resilience, 3 to 4.30 indicate normal resilience, and 4.31 to 5 indicate high resilience. In short terms, statistically significant differences in the level of resilience between nurses with pre-existing somatic disorders and those without these disorders. Nurses with pre-existing somatic disorders had a lower average resilience. So they are less prone to something that we can explore in the future compared to those without such disorders. But the results did not indicate a statistically significant association between pre-existing somatic disorders and resilience in the group of medical nurses. Second, not item, but second condition, like pre-existing psychological conditions or problems, we found the difference in resilience between nurses with pre-existing psychological problems and those without. And it was statistically significant, sorry. Nurses with pre-existing psychological problems more frequently exhibited low resilience compared to those without psychological issues. We have only 14 of them, but in terms that somebody is prone, that we have a profession, COVID, and psychological problems, 14 out of 300 isn't so less. It isn't so small number. Nurses with pre-existing psychological problems had lower resilience compared to those without, and psychological issues and resilience were correlated. Somatic complaints not correlated, but psychological problems were correlated. Nurses with pre-existing psychological problems more frequently had low resilience compared to those without. In summary, statistical significant differences we find only and consistently in a whole sample and between nurses when we are talking about resilience. In 2021, we found more responders with low level, and in 2020, we found those data in a sample of medical nurses. What is good, that anxiety and stress are less prominent, but level of depressiveness is higher in 2021, and not so big or not so high in 2022. In 2022, nurses with pre-existing somatic disorders had a lower average resilience compared to those without such disorders. And also, nurses with pre-existing psychological problems more frequently had low resilience compared to those without such symptoms. What should I say in conclusion, like a message? At the personal level, we have to look for help as soon as we feel unusual symptoms like depressiveness, anxiety, insomnia, according to other authors, because we didn't explore insomnia or PTSD. And which is very important at the professional level, call for talk about organizational activities. They should be pleasant for all to attenuate the level of stress or negative influence of COVID-19. I think that I should conclude that COVID-19 pandemic had significant influence of all of us. We present only a small piece of that influence, maybe a little bit confusing, but I think that, and I would like to answer all questions and our future discussion and printing. And we are did we make answers? I think that we answer some questions, but resilience is a very huge concept, and it's not only psychological, it's psychiatric and medical and scientific concept. So we are still looking for answers. We do not have superpowers, and we have to build our resilience. I suggest to take care and there is my email address. I would like to keep in contact with all of you, and if you have questions, do not hesitate to ask me. It was my presentation.
Okay, thanks a lot, Dragana. I think thanks for this interesting talk. I think it's not easy to get all these people re-examined, and so in this respect, it's quite impressive. So the question is, this COVID now is in a different state. We have, at least in our country, areas where it flares up, where it does come down, and the attitudes have changed quite a lot. I think people are not isolating anymore. They accept the disease. So what should we do in the future? So one question is, how would the future look like? So what is the future going to be? Are we going to accept it like the usual flu, or do we still see it differently? So that's the question. So what's the future concerning the attitude to COVID? And what the second question would be, how to increase the resilience of people. And if people want to ask questions, please, you can click the button where you raise your hands, and I bring the faces up, and then we can talk. Okay?
Thank you for your question. I think that we are not, when we are looking at COVID nowadays and influence of COVID of all of us, we are not at the stage that we are looking on COVID like flu, like influence, because 2020 is not too distant for us. We are still in some shadow of not isolation, but of uncertainty. Some talks about COVID in a different way of other diseases, infectious diseases, But I think through the time, it will get better and better, and it will definitely be situation like some other infectious diseases like influenza and so on and so on. And the second answer on second question, what to do to build resilience, it will be a question for me and for my team. I there are there are less things in Serbian population, in Serbia as my country, that I would be proud of. And I am proud of resilience. And I think that some things are, what can we do is to prepare and to learn something from the past pandemia. There are good examples that people are, I know that colleagues from Israel medical setting, for example, they have presentations what to do in situation of pandemia. Serbia was not well prepared for that. And I think that we should prepare our students and our colleagues for similar situation, even maybe we do not face in our lives with such pandemic like COVID. Also, their strategy, they arise from the point that that something could change our lives in a day, in a month. We are well prepared for lazy life, and we like to work, we like to earn money, but there are some things that we have to measure, to balance between work and pleasure, and to have some good activities, and I think to learn from the past experience, coping strategies, and so on and so on.
Right. Is there any other questions at the moment from? I can ask you, are you going to continue your observation of this sample, or is this more or less done, or what's the future of your study?
I would like to publish something because I didn't see any article about 3 consecutive years. But I think that we will repeat the research maybe in 2025 or 2030. You know, we have time to pass and to remind people on COVID, because I think in 2024 we will get the same answers. It's my feeling.
Right, so there won't be much change. Is there any other questions?
Yeah, I would like to ask you a question. First of all, thanks to Dragan, it's very informative presentation. So I'd like to ask you a question about the transgeneration of the COVID. You know, maybe some researchers are considering the COVID-19 is a historical trauma. Do you think the psychological trauma of the COVID-19 will be transferred for the next generation? For example, now we have many traumatic events. Let's say in the war, in the what happened to Yazidi people in the Iraq. Now we are doing the research on the generations, not just the survivors. Okay, to see the war and the trauma happening to the parents or transferring to the kids or the offspring or not. So do you think after 5 or 10 years, should we do a research on the new generations to see the COVID-19 impact on the parents transferred to the generations as a transgenerational trauma?
Thank you, Dari. It's a very good point, and I think that the trauma of COVID can be transferred through generation, psychological side of COVID, but I think that every trauma is not the same trauma, because COVID is infectious disease, and there is a curable aspect of infectious disease. So maybe it would not be influential as much as we can assume, or we have previous experience. Firstly. Secondly, at the place of former Yugoslavia, we had 30 years ago, we had wars, and we still have transgeneration transference of psychological trauma. It is different type of transgeneration transfers when we compare with COVID. And thirdly, for me, you give me idea that we can invite people who suffered loss or death of their relatives in the family, and compared them now and in the future with those who didn't have lost. I think that it would be different influence of them, you know, because sometimes COVID is not curable. It could be a bias, but I think that you give me an idea. Thank you very much.
Thanks for your answer. Yeah, it's a very interesting topic, you know, because currently we are working on the trauma research project for the Holocaust, for the Anfal and the chemical attacks happening in the Iraq and after the US invasion. So we are asking the generations, did this trauma transfer to you? Have you lost any parents or family members? So some of them, you are right, some of them, they have this trauma transfer significantly, especially those are people that their family is significantly impacted by the trauma. So in the COVID, we have the same thing. We have a family here, 5 people in the same family have been died because of the COVID, and this might be transferred to the generation. So it's very important to conduct a study on the next generations, not just on the survivors of the COVID-19. Yeah, thank you very much.
Okay. If there are no other questions, then I would say thank you to Dragana, and I hope we hear something about your study in a couple of years. We're very welcome to publish some of your data in Global Psychiatry Archives, and maybe you can consider that. And yeah, so if I think Florian is already available, Florian Wiese. And so is that an option that Florian just can start now? So then we can see that I think people get tired a bit. And so can we bring his talk forward? Florian, are you available?
Can you hear me?
Yeah, I can hear you. I can't see you.
Okay, perfect.
Can you just, thanks, Dragana. Thanks so much.
Thank you.
Okay. I quickly need to close the door of my room, and then I'll start with the presentation. And